Hello, everyone. Today we're going to discuss chronic kidney disease. So, what is chronic kidney disease? It is a slow decrease in the function of the kidneys over time, usually at least 3 months, and it happens slowly over time. There typically are no symptoms early in the disease. Symptoms come much later. So, I've had a few of you come to see me in clinic and say, I'm experiencing some back pain and I'm worried that my kidneys are not working well. Typically, there are no symptoms early on in the course of chronic kidney disease. This is why we have to see you routinely. We have to get lab work done. We're usually checking blood work. We're measuring the creatinine, which helps us to calculate the glomerular filtration rate. And then we're checking the urine for small proteins in the urine. These are the things that help us see how well your kidneys are working. So I mentioned that there are no symptoms early on, but later on in the course of chronic kidney disease, there can be symptoms. And these symptoms reflect the failure of the work that the kidney does. So for example, the kidneys filter out waste products. And so late in the course of chronic kidney disease, when the kidneys aren't working as well, you can have buildup of waste products, which can be seen with confusion, weakness, fatigue, like real tiredness, dry skin that's very itchy, things like that. It reflects work that the kidney should be doing that it's no longer doing very well. The kidneys help remove excess fluid from the body. So when the kidneys aren't working well, people can get swelling in the legs and things like that. The kidneys help to produce blood cells, red blood cells. So when the kidneys aren't working well, people could be anemic, and then they'll be very tired with anemia. The kidneys help in the metabolism of minerals that our body needs. So when the kidneys aren't working well, people deal with things like having problems with calcium and other minerals, vital minerals that the body needs, and that affects the bones. And then the kidneys are also involved with blood pressure control. So there can be more issues controlling blood pressure when people have chronic kidney disease. But these symptoms, like I just mentioned, are usually later on in the course of chronic kidney disease at the very late stages. Early on, there may not be any symptoms. So you must follow up closely with your doctor, especially if you have risk factors. So what are the things that are risk factors? We'll talk about them together with how we can prevent chronic kidney disease. And if you do have chronic kidney disease, how you can slow it down from getting worse. One big risk factor is diabetes, high blood sugar. Diabetes, one of the complications is that it affects blood vessels, and so it affects the blood vessels in the kidneys and slowly causes chronic kidney disease. So one of the ways to prevent chronic kidney disease or to keep it from getting worse is to make sure that your blood sugar is very well controlled. Same thing with high blood pressure. High blood pressure also causes damage to blood vessels in the kidneys. And so making sure your blood pressure is very well controlled is one important way to prevent chronic kidney disease, as well as to preventing chronic kidney disease from getting worse. Heart disease can affect the kidneys. Again, it affects the blood flow, the blood that gets to the kidneys. And so controlling any kind of heart conditions that you have, especially congestive heart failure, can help to prevent chronic kidney disease or prevent it from getting worse. It's interesting because kidney disease is a risk factor for heart disease, and heart disease is a risk factor for chronic kidney disease. They kind of go feed into each other. Smoking damages blood vessels everywhere. And so if you smoke, you are high risk for chronic kidney disease. Stopping smoking is one of the main things you can do for your health. The complications are just too many. But quitting smoking is very important to protect your kidneys, to prevent chronic kidney disease, and to prevent chronic kidney disease from getting worse. Frequent dehydration. So Sudden dehydration will cause acute kidney disease. The kidneys will usually recover. That's a short-term thing. But if you have just week upon week, month upon month, year upon year, you just don't drink enough water, that frequent mild dehydration over time can cause chronic kidney disease. So it's important to make sure you're well hydrated to protect your kidneys and to prevent chronic kidney disease from getting worse. Certain medications, and one that I really have to stress is a group of medicines we call NSAIDs, non-steroidal anti-inflammatory medications. These medicines are things like ibuprofen, Brufen, Motrin, Advil, or naproxen. It's called Aleve here in the US. There other medications in this class, meloxicam and things like that. Frequent use over time causes chronic kidney disease. So it's different if you need it every now and again for a headache or a fever or something like that. But usually people who maybe get migraines, or especially if you have arthritis and you're taking something for pain over and over again, daily, multiple times a day, over time, that will damage your kidneys and it can make kidney disease worse. So if that's you, talk with your healthcare provider about alternative ways to control your symptoms so that you're not taking a lot of NSAIDs frequently over a long period of time, because that will damage your kidneys. The other thing I want to mention is obstructions. So especially as men get older and you have problems with urine flow from the prostate, or people who have kidney stones, or any kind of obstruction to the flow of urine, those can cause a backup of pressure, which over time can damage the kidneys. So again, following up with your doctor, managing any kind of urinary flow problems so that you don't have a backup of pressure that damages the kidneys. And then there are other things, I like to talk to you about things that we can do things about. There are other things that you may not be able to do anything about. For example, getting older. Getting older is a risk factor just because you're born with the kidneys you're born with. So over time, they can wear down. There are other things like some autoimmune diseases where the immune system just attacks itself. There's some inflammatory diseases that can affect the kidneys. There's some inherited diseases like polycystic kidney disease. But for the things that we can work on, diabetes, blood pressure, heart disease, smoking, making sure we're well hydrated, avoiding medicines that can damage the kidneys, and then managing obstruction so that pressure doesn't build up into the kidneys. All those things are important for us to do. And then I would stress just following up regularly with your doctor. Like I said, early in the course of kidney disease, there are no symptoms. So following up with your doctor to make sure things are getting monitored. That way, if something starts to go wrong, you know very early, and you can take steps to prevent worsening. We also monitor for complications. So I've mentioned the things that the kidney does. So we monitor for things like the anemia and problems with vitamin D and calcium and all of those things. So following up closely with your doctor. Do the things you can to protect your kidneys, to prevent kidney disease from getting worse, and then partner with your doctor for monitoring and treatment. Thank you.